scientific medicine, and really the traditional medicine should be considered the alternative medicine at this point. And so let's talk about the synapse. This is what every pharmaceutical company is trying to influence here. And in this case, we're going to be talking about L-tyrosine at the very top of that neuron here in a little bit. But the L-tyrosine has to get into the brain. We could also talk about tryptophan. Tryptophan is an amino acid. Both of these are building blocks of protein. And so this is, our neurotransmitters are made out of amino acids. And so the L-tyrosine turns into L-dopa. The L-dopa can turn into dopamine. And then with free copper, the dopamine can turn into norepinephrine. Now a little bit about dopamine. Dopamine is where your motivational chemical is. If you're not properly motivated, you've got issues with your dopamine activity. Norepinephrine is where your energy is at. So if you're having problems with energy, you're having a problem with norepinephrine. So the norepinephrine can help the fatigue aspect, can also help the focus aspect. If you're having problems focusing, more norepinephrine can be helpful. So these chemicals have to be made in the neurons themselves. Now, you might think, well, if you're having problems with motivation, why don't you just chew a pill that says dopamine? Or why don't you come in with an IV and get an intravenous dopamine? That actually will not work. Why doesn't it work? Because dopamine does not cross the blood-brain barrier to get into the brain. It can go from your GI tract to other places, but it's not going to get into your brain, which means we have to make it in the brain. We have to get the L-tyrosine in there. We have to get the other vitamins and nutrients in there to be able to produce enough of these neurotransmitters. So when the doctor puts you on a drug, say like the doctor recognizes, okay, this person has a fatigue problem, he's got a motivational problem, he's got a focus problem, I think he needs to have more dopamine and more norepinephrine activity. So he'll give you a medicine and he'll say, this will help your dopamine activity and your norepinephrine activity. Does that drug help them make more of those chemicals? No. Does it help them build up more of the receptors so they're able to grab onto that molecule? No. So how does it work? Well, notice when this norepinephrine, in this case it's norepinephrine being released here, when the norepinephrine is being released by those large white vesicles there, it's moving up to the membrane, the electrical transmission releases the norepinephrine, and then it binds onto the receptor, then that neuron fires, but when it fires, now that norepinephrine is released, and notice how those arrows show it's vacuumed back up into the original neuron that released it. Why is it vacuumed back up? So it can be used again. It takes several million ATP molecules, which is the energy portion of your body and brain. It takes several million of those ATP molecules to make one norepinephrine. And so it needs to be reused so we don't have to use all this brain energy to make more. So how do the pharmaceuticals work? They're called, in this case, if the doctor's giving you something to help your norepinephrine level, it's called an SNRI. What does an SNRI stand for? It's called selective norepinephrine reuptake inhibitor. So what is it doing? It's actually going into that reuptake channel and blocking it. So these are drugs like venlafaxine. I'm sure venlafaxine is used here in Zimbabwe. It's known as Effexor, Pristiq. These are duloxetine is another one of the SNRIs. And so I'm sure that that's probably used here as well. And so those medicines will plug the reuptake channels. What does that mean? That means if you're short in norepinephrine in the synapse, if the doctor guessed right and you weren't having enough norepinephrine activity, since it prevents it from being vacuumed back up, there's more norepinephrine in that synaptic area so that it can bind onto a receptor. So it actually does help the norepinephrine activity for a while. But there was a problem because the neuron was already too short in it. And now we have less norepinephrine being reuptake. And so this is why a year later you have such high relapse rates. It can help for a while, then the person goes into a relapse, and now they're needing higher doses and more medicines. And this is how we create what we call psychiatric cripples. These are people that are going to need to be seeing doctors for life because they're going to be having to get medication adjustments all the time because now they're relapsed and now their norepinephrine levels are even much lower in the brain. And so now the doctor is adjusting multiple medicines, multiple doses, and this is the typical case that I'm describing to you of someone with depression and anxiety in the United States after they've been seeing doctors for several years. So by the time they come to our program, they're usually on 4 medicines, and they're still severely depressed or severely anxious. And no one has done a workup to try to find out why wasn't that neuron making enough serotonin or norepinephrine or dopamine to begin with. By the way, serotonin will help you with your mood, and it also helps you to be less irritable. It helps you to be more agreeable. There's a lot of marriage partners that wish their spouse made more serotonin to be a little more agreeable and a little more, less irritated, etc. So the fix to this is actually nutrition and lifestyle. The fix is not the medicine. The medicine is a short-term, maybe advantage that has some maybe disadvantages as far as side effects are concerned. And by the way, the SSRIs are even more common. What does SSRI stand for? That's selective serotonin reuptake inhibitors. So it's plugging the serotonin channels. Those are the original reuptake inhibitors. And that's Prozac, that's fluoxetine, that's sertraline or Zoloft, that is citalopram or S-citalopram, which is Celexa and Lexapro. And so there's a whole number of those SSRIs to choose from. Paroxetine, which is Paxil, is yet another one. And so the serotonin, when we start plugging the reuptake channels, we get some unwanted effects. There are 2 primary unwanted effects of the reuptake inhibitors. They can, as mentioned, the serotonin reuptake inhibitors can improve your mood, but they actually tend to make your apathy worse. Apathy is an I don't care attitude. Now, a lot of people with crying spells and depression like that because if they were having crying spells and now they don't care, their crying spells go away. And so they say, it's working. My crying spells are gone. But if something really sad happens, like their spouse dies, they're not even sad about it. and they can't even cry at the funeral. And they're recognizing, I used to love that man, but oh well, he's gone. And so that, of course, is not healthy. It doesn't help you, of course, with the grieving process and to be able to heal from that grieving process. It also does something else that's even more concerning, and that is it worsens impulsivity. We talked to you about self-control. If you have someone who's depressed and now you make them impulsive, what are they more likely to do? They're more likely to end their life through suicide. Suicide is often an impulsive act. And so I'm sure you have package inserts on pharmaceuticals that are distributed by pharmacies here. But in every one of these package inserts, it says, watch out, giving this medicine could increase their risk of suicide. Wait a minute. I thought I was giving this to help their depression, to be able to help their suicide. But the studies show the impulsivity goes up first before the depression clears. So many suicides in America, it's the first month that they're taking these medicines. It's before the depression cleared, and now you worsen their impulsivity. This is why if you have someone who's thinking about suicide and you put them on one of these medicines, you need to be seeing them every day. They need to be in a residential program or something like that so that you can see what's going on and see what they're talking about and make sure that they avoid that aspect of things at least until the medicine starts to work. But if we fix the underlying defect, why they're not making enough norepinephrine, why they're not making enough serotonin, we don't have any of those bad side effects. Their mood gets better and their impulsivity gets better. And so they're going to be far less likely to commit suicide. So any questions about that aspect of things before we move on? I want to make sure we understand what we said here. By the way, there's other side effects as well. We mentioned sexual side effects. It's a lot, it adversely affects libido, and which is your motivation for sex if you're in a marriage relationship. And it also can cause it more difficult to climax, and it also can be painful because of the retrograde ejaculation that can occur in males as they're taking these medicines. So you're trying to improve their depression, but you're causing some unwanted side effects as well. And of course, that's just a few of the major ones that can happen. So not seeing any hands go up. We'll go on further. Oh, there is a hand that is here in the front, if anyone has the roving microphone. All right, she grabbed a microphone and we'll get this question here.
This lecture sounds really deep for maybe the short space of time we have. Are we going to get any handouts or so that we can study?
So that you can remember?
We can study.
Yes, so good question about that. We did, for what it's worth, we did bring material that has, our books and textbooks and also workbooks that has a lot of this information. But we might be able to, I'm not sure what the availability is, and we'd have to choose the right slides that you've seen here. There might be availability of something like that later. Yes, is there another question? Yes.
With Prozac, that seems to be what is widely prescribed here. And I've got people, as I told you, in the complex sleeping 11, 12 hours. Is that a side effect of Prozac and those kind of things?
So they're sleeping, did you say? 11 to 12 hours? Yes, and part of that can be due to the I don't care attitude that it causes. If you don't care and there's not much to do, then just sleep, So That can be a side effect of it as well. Yes. All right, not seeing any other hands, we'll move on. So, nutritional causes. It's possibly the most overlooked cause of diminished mental power, depression, or anxiety. It can have profound effects. Once a nutrition change is adopted, it takes 7 to 10 days to begin noticing a difference. But the gradual improvement continues with the maximum effect taking place 6 months after a consistent change has been made. This is something we're talking about, the new lifestyle center that just started on a small basis here in Harare, not too many miles away from here. And as mentioned, we have 2 of those lifestyle centers on the campus of Weimar, one for mental health, one for physical health. But when we make the dietary changes, and of course when they come to our program, we have to tell them, don't bring food in. We want them to only eat our food for good reasons. They need to start making these neurotransmitters and doing better. And we don't want them on food that's going to sabotage them. And in general, they really like the food. We have good chefs, and they can make food that's nutritious and healthy. But they're there for 10 days. And so they've started to get better, but the full effects of that diet have not taken place yet. So we have to encourage them. Don't go back to your old way of eating. And don't go back to your old restaurants as well. So we try to help them. We actually give them a sack lunch so that they're not tempted to eat their old McDonald's menu at the restaurant and say, I missed that hamburger for all these days here, and now I'm out of this program and I can eat that. Well, that would sabotage them in regards to continued improvement. And so we want them to stay on this program for a number of weeks. This is why we also help them with the self-control part of things, how to manage their emotions when they're tempted like that, etc. So what can be some of the nutritional problems? Not enough tryptophan. Tryptophan is the least abundant amino acid in the diet. And particularly, it's a problem to get tryptophan into the brain. So first of all, they might be short in it. Secondly, they might not be eating the right things to even get tryptophan into the brain. Maybe not enough tyrosine. If you don't have either one of those amino acids, you're not going to make those neurotransmitters in the brain. Excess cholesterol. Cholesterol will actually decrease the activity of the synapse. This is why we see a lot of treatment-resistant depression. As you noticed, 30% of people don't respond to any antidepressants. And they'll keep going to the doctor, and the doctor will say, try this, try that. And about a third of them won't get a bit better no matter how many medicines you put them on. But you get them on a diet where their cholesterol goes down, and all of a sudden they start responding. So we need to get the cholesterol down to have a response. Too much arachidonic acid. Arachidonic acid is going to cause inflammation. Inflammation in the brain causes depression and anxiety. So we want to get rid of the fuel that throws fuel on the fire of inflammation. Not enough dietary folate. Folate is a B vitamin. Sometimes it's called vitamin B9. But we need folate to make 3 different neurotransmitters in the brain. So we might be getting enough tyrosine. We might be getting enough tryptophan, but we might not be getting enough folate to be able to make this. Not enough iron. Now there can be problems with too much iron, but there's also problems with too little iron. Iron is one of those nutrients that we need to have enough of, but not too much. This is why I'm against, for instance, having iron put into a multivitamin pill. We have a lot of Americans that want to make sure they're not short in anything, so they're taking these multivitamins. And if they don't need iron, that iron in that pill will shorten their life. And an interesting study showed just published recently, 1 out of 3 Americans take a multivitamin every day. 2/3 don't take a multivitamin. Which group do you think lived longer? It was the group that was not taking the multivitamin. Slightly, very little difference, but a 4% difference in longevity, and the 4% difference was those not taking the multivitamin. And of course, that raised the question, why are the multivitamins harmful? Because people are taking things that they don't need. And if you have excess of what you don't need, a lot of these multivitamins have copper in them as well. Too much copper will cause some significant health issues and also significant brain issues. So that's why you only want to take what you're short in. And some of these multivitamins have mega doses of something you don't even need. Low omega-3 fatty acid intake. Omega-3 is healthy for the brain. It's an anti-inflammatory fat, and it helps us in a lot of different ways. But the typical person in the world does not get enough omega-3 in their diet. We'll talk about that. Not enough magnesium. Magnesium is crucially important for us to be able to methylate and be able to make these neurotransmitters and to be able to even make melatonin. This is why a lot of sleep aids have magnesium in them, so that you can make more melatonin at night. And this was a big one as well, not enough zinc. So you can have too much of some things, not enough of another, and this can all cause issues. And then it could be some other B vitamins like vitamin B6, it might be choline, it might be resveratrol. So these are things that we're measuring and looking for when someone comes to our program. So let's take a look at the big one, and that is tryptophan. Notice dietary tryptophan does not necessarily equal brain tryptophan. Why is that the case? Because tryptophan does not just diffuse into the brain when we eat it. It has to be taken by a carrier. Tryptophan is what we call a large neutral amino acid. It's too large to get into the brain by itself. Now, there's something called the blood-brain barrier. The blood-brain barrier only lets small molecules get into the brain to protect your brain from toxins, which are normally the large molecules. The oldest cells in your body are in your brain. The cells that were there when you were a fetus, before you were born, are still alive in your brain. And those cells can go away if there's toxins allowed in. And so this is why the brain is the most protected from toxins, because we can't regenerate those neurons if they go away. And so even tryptophan needs a specific carrier to carry it across. Now, it'll also carry 5 other large neutral amino acids, same carrier, to carry out 6 different amino acids crossing the blood-brain barrier. So tryptophan is converted in the brain to serotonin in the daytime. And we talked about one of the things the last hour that improves serotonin production if we have the right nutrients in there. What is it in the daytime that will help you make more of this? It's light. Yep, light through the eyes. Melatonin, we make that at night, and also niacin is made from it, another B vitamin. As mentioned, it's the least abundant amino acid in the diet, and the conversion of tryptophan to 5-HTP. 5-HTP is necessary for us to make serotonin. It goes tryptophan, 5-HTP, which is 5-hydroxytryptophan. And then for those of you that remember biochemistry, it's then 5-hydroxytryptamine. 5-hydroxytryptamine is the same word for serotonin. Notice it's inhibited by stress. So if we're really stressed out, like that lady was on the airplane that I examined last night, if we're really stressed out, our brain's not going to be able to make that final step to make serotonin. This is why it's a combination. It's not just nutrition, But we also want cognitive behavioral therapy to help us be able to build up frustration tolerance to be able to make more serotonin. Cognitive behavioral therapy has been shown to change your brain chemistry. And some people don't want to go to counseling because they say, my problems are real. I don't need counseling. In other words, I need my biochemistry fixed. But they don't realize that good counseling can help them tolerate frustrations and improve their brain chemistry. It's also tryptophan to 5-HTP is inhibited by insulin resistance. What's another name for insulin resistance? Diabetes. Can you have diabetes, or can you have insulin resistance without diabetes? Yes, that's called prediabetes or metabolic syndrome. So if someone has metabolic syndrome, we measure all of our patients for this, by the way, when they come to us. If they have metabolic syndrome or diabetes, what are we going to do to help them make serotonin better? We might cut down their sugar intake, but even more importantly, we're going to put them on an exercise program. Exercise works like insulin to get the tryptophan across that blood-brain barrier, and we need that insulin activity. Magnesium or B6 deficiency will also reduce serotonin production, lack of light, and of course increasing age. When I was raised in America, depression was almost unheard of in the younger age groups. In fact, that wasn't the word for it. The word for depression among lay people was called the midlife crisis. So midlife crisis is when you started to suffer it, which is kind of in your middle age if you had issues. And then when you were elderly, it was expected that you might have more of that. And so the older you got, the more depression tended to occur. Now we see elderly with far more rates of depression than what they used to, but the highest age group is under 30 in America. In fact, depression is so common in those under the age of 30 in America that a person who's under 30, who's mentally healthy, is considered the abnormal person. You say that, in this country, like America, there's probably a stigma. A lot of people don't want to be diagnosed with depression or anxiety because it's a lifelong looking down on that person that they have it. The stigma is gone in America because it's so common that they're not stigmatized at all by it. It's like, well, yeah, I've got it, but so does everybody else. But it doesn't have to be that way. They can, of course, significantly improve. And so it's easier to have a 30-year-old improve or a 20-year-old improve in our program because they have the ability to make it more so than an elderly person. But even an older person, if they have all the things in line, will still be able to make enough serotonin to stay out of depression and to have optimal brain chemistry. So tryptophan supplementation has been shown to improve general mood. It can decrease quarrelsome behaviors, increase agreeable behaviors. It improves premenstrual dysphoria. Just yesterday, when I was in the Johannesburg airport, my staff, we're not sure how this happened, probably the receptionist was out of the loop or something, but my staff scheduled patients for me to see while I was on the airplane to Johannesburg. And one lady was still able to meet by phone in the Johannesburg airport. So I called her up. It was my second visit with her, and we had done some tests. No, it wasn't the second visit. It was the third visit. The first visit, we had found out what her biochemical issues were. The second visit, we had started some supplements to be able to fix the biochemical issue. And so she had bad premenstrual dysphoria. That's why I'm thinking about it here. Before her period, her life would fall apart. Her husband could tell the hour that she ovulated because she was so happy and such a good wife And then all of a sudden, nothing was right with the world. We call it premenstrual dysphoric disorder. And it was causing issues even with the small kids that she had. And she had also had postpartum depression and things like this. So we found out that she was an undermethylator genetically. And she also had an issue of too much free copper. If you have too much free copper, you're not going to make enough dopamine and you're going to make too much norepinephrine. And that can make the premenstrual dysphoria worse. So I talked to her, I said, so how's it going? She says, the first week after I started supplements, I had a period after that and it was 20% better than it had been. The next time I had a period, it was 60% better. And now I just had my third and it's 100% better. I have had no downs at all in my premenstrual dysphoria. And so you can see the difference it makes once we're able to get those neurons to make those neurotransmitters. Tryptophan has also been shown to help seasonal affective disorder. Seasonal affective disorder would be more common in Zimbabwe around this time of year when you don't have as much light, because it's wintertime here, and so there's more night than there is daytime. And in America, you have more depression in the opposite time of year, around January, February, or December. It also, of course, helps depression and improves insomnia. Why do you think tryptophan improves insomnia? Because you're able to make melatonin, that's right. And so this is the amino acid to make melatonin. It also can improve sleep apnea, obstructive sleep apnea. We think of that being improved with a CPAP mask or with weight loss if you're overweight. But it's also been shown to improve with tryptophan supplementation. It helps the brain to be able to breathe at night. And it also helps with withdrawal from drugs. Nicotine withdrawal is known to be one of the hardest drugs to get over with. It's very addictive, nicotine. But when we get them on adequate serotonin being made in their brain, it's far easier to get over this. And when people come to our program, they'll talk about, wow, how easy it was to get off my drugs that I was struggling with so much. And sometimes we have to actually warn them, because they think it's so easy when they came here that if they go home and they pick it up again, it's just, oh, it was so easy, I can just put it back down again. No, don't try that at home. It's going to hook you again. And so we have to, but they are pleasantly surprised. They think they're going to go through all sorts of withdrawal and all of that stuff, but their withdrawal symptoms are very mild when they come. It can also improve autism. Are you getting autism over here in Zimbabwe some? I know it's increasing in America. Of course, it improves your cognitive function, your ability to learn, retain, and apply knowledge. And it's also been shown to improve social affiliation. If you want to isolate and stay away from people, that could be a problem of not making enough serotonin in your brain. And of course, it also improves sleep. So these are the foods that are high in it. You can see oats, not a bad source. Tofu or soy is a good source. Flaxseed is even higher yet. Now this is taking a look at the concentration of milligrams per 100 grams. Walnuts have even more. Sunflower seeds more. Sesame seeds even higher. One of the highest sources are chia seeds. Do you have chia seeds in Zimbabwe? All right, very good. And I think we saw them in the Johannesburg airport. There was this chia pudding that was there. And then pumpkin seeds and squash seeds particularly are high. Now the raw ones are high too, but if you roast it, you even have more of that amino acid available. So pumpkin seeds, do you have pumpkin seeds here? Yeah, they're usually a pretty inexpensive seed, but quite high in tryptophan. We not only need tryptophan, however, we need carbs with the tryptophan to get it into the brain. So there's 3 critical dietary factors working together to improve mood and cognition. The first is tryptophan, the second are carbs, and the 3 water-soluble vitamins and minerals like magnesium. Notice this summary from research. Large neutral amino acids compete with tryptophan to cross the blood-brain barrier. Carbohydrates derived from whole foods tend to reduce the stress hormone cortisol. Carbohydrates induce muscles to uptake large neutral amino acids. That's if you're exercising, thus improving tryptophan access to the brain. This is one of the reasons why exercise works, because it uptakes the large neutral amino acids, allowing more tryptophan to cross the blood-brain barrier. Carbohydrates increase brain tryptophan absorption and therefore increase serotonin. A low-carb, high-protein diet reduces the amount of tryptophan in the brain. So this is something that's not very intuitive. A lot of people think, all right, I need to make more serotonin, I better be getting a lot more protein. But if they eat high protein, they actually get less serotonin in their brain. That might be an additional reason why Arnold Schwarzenegger had problems with self-control as well, because he was on that high-protein, low-carb diet, and that wasn't helping his serotonin output. Notice this study by Dr. Young, printed in the Journal of Psychiatry Neuroscience. Tryptophan is transported into the brain by a transport system that is active toward all the large neutral amino acids, and tryptophan is the least abundant amino acid in protein. There's competition between the various amino acids for the transport system. So after the ingestion of a meal containing protein, the rise in the plasma level of the other large neutral amino acids will prevent the rise in plasma tryptophan from increasing brain tryptophan. The idea common in popular culture that a high-protein food such as turkey will raise brain tryptophan and serotonin is unfortunately what? False. So one of the things you need to understand about meat, it does have protein, but it's no carbs. And you need to have those carbs. Plus, all of that protein is blocking the effects of tryptophan to get into the brain, because all of those others are in greater abundance than tryptophan. So what are the 5 amino acids that compete with it? We've actually looked at it, and you can see the tryptophan level to the other large neutral amino acids in beef is only 2.6%. Tofu has more, 4.1%. Chicken a little more, 4.4%. But by the way, which one would you get more tryptophan into the brain, chicken or tofu? You get more from tofu. Why is that the case? Tofu has carbs. Tryptophan does not have carbs. Brown rice is going to be much higher than chicken. Spinach, higher yet. Pumpkin seeds. Notice it's just pumpkin seeds, although it's a great source of tryptophan, it has a little more of the competition than some of the others. Quinoa. You guys have quinoa here? Quinoa is a grain that is good for making serotonin. Flax even higher. Cauliflower. You guys have cauliflower? Okay. Cauliflower is a great food. We actually make cauliflower soup. It's a very tasty dish. Sweet potato, even more. Grapes are a good source as well, and percentage-wise, and the highest is actually chia seeds. And so this is also why we're recommending, and we actually have flax seeds and chia seeds there in our program. So tyrosine supplementation is also helpful. It reduces headaches, stress, fatigue, muscle aches, and sleepiness compared to controls. So if you're too sleepy, that tyrosine can be helpful. Improvements were noted in mood and mental states and cognitive tests in the tyrosine group. Tyrosine increased feelings of vigor and also improved blood pressure. Now the SNRIs, which is what your doctor will give you if you have depression with fatigue levels, The SNRIs, by blocking the norepinephrine reuptake channels, actually worsen blood pressure. So if you have high blood pressure, these are not good drugs to be on because they're going to raise your blood pressure even more. But if we get to the root of the problem, which is not enough tyrosine into the brain, not only does the mood improve, and your focus, and your energy, but your blood pressure also lowers. And so this is, of course, a good sign when we're seeing all positive effects and no negative effects. These are the foods that are highest in tyrosine. Notice the greens are a pretty good source. Tomatoes, lima beans, tofu, edamame. Edamame is actually higher in tyrosine than regular soy. Edamame is your green soy. You guys have edamame here? Okay, so it's the more immature soy. We have it a lot in America. It's put in salads, kind of raw. It can be tasty. There's a lot of different edamame dishes, but good source of tyrosine. Eggs have some, but there's even higher sources than eggs. Almonds, oats. So oats are better than tyrosine than even tryptophan. Sunflower seeds. Notice near the top is wheat germ. When we're eating white bread, we've removed that germ and we're not getting the tyrosine. In fact, it's better to not eat than to eat white bread or refined grains. And so, but it's actually good to eat the whole grain with the wheat germ. It's not only high in tyrosine, it's also high in omega-3 when we get to that. And it also has a lot of other good nutrients. So whole wheat's been shown to be antidepressing and anti-anxiety as well. Now there's a lot of these fad diets telling you to eliminate wheat as if gluten is a bad thing. Gluten is not a bad thing unless you're sensitive to it, and only less than 4% of the population is sensitive to it in some way. Less than 1% has celiac disease. Celiac disease patients should not eat gluten or wheat or anything like that. But there's a lot of people that think everybody should avoid wheat and gluten. Not healthy. In fact, your gluten-free people have a lot more problems with diabetes. They have a lot more problems with other issues because they're not eating the whole wheat. Notice peanuts are a good source. Do you guys have peanuts here? Do you grow peanuts here in Zimbabwe? I would think this is a good climate to grow peanuts. Yep. High in tyrosine. And then notice pumpkin seeds, again, are high. So pumpkin seeds are high in tyrosine and tryptophan. When we look at the ratio of tyrosine to its competition, however, we see some good foods like sweet potato, surfacing, flax, chia seeds. We probably shouldn't have beef on there. Beef is 18%, but again, it's the same issue. You've got to have carbs, and beef is going to be no carbs or 1% carbs at best. And so you're not going to be getting that beef tyrosine into your brain anyways. Tofu will have more, pumpkin seeds more, soybeans more, but notice watermelon and mustard greens are at the top of the list. I think you have watermelon here in Zimbabwe as well. And once you're caffeine free, watermelon is going to be a stimulant to you because it's going to help you make more dopamine and norepinephrine. So our program is a caffeine-free program. Caffeine and anxiety don't go well together. And for some people, caffeine and depression don't go well. So when we take them off their caffeine and they're needing to drive somewhere all night due to an emergency, they're thinking, okay, I need to have my caffeine so I don't go to sleep. Actually, if you take watermelon and you're caffeine-free for at least 2 weeks, you're also not going to want to go to sleep. But you won't feel as anxious. Caffeine causes anxiety. It causes you to get a little bit of a feel wired, where the watermelon won't do that. It won't make you feel wired at all. And so the cautionary note, don't eat watermelon at nighttime. Once you're caffeine-free, it's going to want to keep you up at night. So the ironic conclusion, don't chow down on high protein sources to boost either tyrosine or tryptophan. Lower protein diet, as long as it's adequate, leads to more amino acids in the brain. and emphasize the carbohydrate-rich plant sources of nutrition. So we talked about high cholesterol. Patients with major depression tend to have significantly higher cholesterol levels than healthy adults. Depressed patients with elevated cholesterol levels have a poorer prognosis for treatment response. Lowering cholesterol improves depression and mood as well as lowers impulsivity. So we'll have less suicide and more self-control when our cholesterol is down. Now let's take a look at the foods that are high in cholesterol. First of all, fruits, grains, nuts, and vegetables. Plant foods don't have cholesterol. Skim milk, 4 to 5 milligrams. 2% milk, 18 milligrams. Whole milk, 33 milligrams. Egg white is the only animal product exception rule. No cholesterol in the egg white. Mayonnaise, 8 milligrams. Ice cream, 29 milligrams. Tablespoon of butter, 31 milligrams. But notice the egg yolk, loaded with cholesterol, 213 milligrams. A lot of people think tuna is the answer, or fish. And they'll think that's actually a plant-based food. No, fish has a liver, it is an animal, it has a face, and it makes cholesterol. And so you put a vegetarian on fish and their cholesterol levels are invariably going to go up. Clams and crab also higher. Notice if you're careful and you scrape the fat and the skin off your chicken, it's not cholesterol free. A lot of people think that's cholesterol free chicken. You still have 73 milligrams per 3-ounce serving. Pork 76, beef 80, and most people don't scrape the fat and the skin off their chicken, and their chicken has more cholesterol than red meat. Oysters are also high in cholesterol. Shrimp, higher yet. And then the organ meats are very high. Kidney, liver, caviar. If you see anyone feasting on beef brains, you have to wonder about their intentions, because you could get a heart attack very quick with that high a cholesterol level. 1,697 milligrams of cholesterol. Now, Bruce Taylor came along, and he told us, he figured out that not all cholesterol was the same. And he figured it out from students. This is why we like to have students rotate with us. Sometimes they ask questions, and they do things that make us think about things differently. And he was teaching at a medical school. He was a pathologist, and he was the cholesterol researcher there. And 4 students came together to do a study. In their medical school, they had to do a study that no one else had done in order to graduate from medical school. So they're looking to see if anyone's done this before, and they found out that no one had fed pure cholesterol to rabbits and monkeys to see what would happen. So it passed the ethics review board, and they now were able to feed pure cholesterol to rabbits and monkeys. And so they came to Dr. Taylor. He wasn't even part of the study, but they came to Dr. Taylor because they needed to get the pure cholesterol to feed it to them. And since he was the cholesterol researcher, they thought he might have some. And he says, yeah, I've got a big bucket over there. You can go ahead and use that. So they fed rabbits and monkeys this pure cholesterol. Within a few weeks, heart attacks and strokes in these poor rabbits and poor monkeys. And they wrote up their data, and they had it written up to be able to graduate from medical school. But Dr. Taylor's thinking about that. Cholesterol is bad, but it shouldn't have been that bad. It'll take years for humans to have heart attacks and strokes eating this way. Why did it just take a few weeks for these rabbits and monkeys? And so he decided that he was going to feed pure cholesterol to rabbits and monkeys that had never been exposed to the air. He remembered that bucket that he had given him. The lid had been off. It had become a little discolored, meaning it was oxidized. Pure cholesterol is very clear and waxy. It's not been oxidized. So he fed rabbits and monkeys pure cholesterol that had never been exposed to the air, and no heart attacks and strokes. He looked at their blood vessels, clean. Then he realized, wait a minute, humans aren't just eating oxidized cholesterol or non-oxidized cholesterol, they're eating food. Let's test the food. And he found out the worst food. In fact, he found it out by feeding it to monkeys, but 24 hours after eating this food, he would go in and count the dead cells in their aorta. Doesn't take long for the damage to be done, they found out, with oxidized cholesterol. So the food containing the most oxidized cholesterol and the most damaging to your blood vessels, according to Dr. Taylor, is custards. Now, what are custards? Custards are made out of milk, eggs, and what else? Sugar. When you mix cholesterol up in a sugar environment, you are going to heavily oxidize it. What's the most commonly consumed custard? At least in America, the most commonly consumed is ice cream. Good old-fashioned ice cream. Do they serve ice cream here in Zimbabwe? I figured they might. Second most damaging. By the way, one of our previous board members at Weimar, he came up with a food manufacturing company that makes ice cream that is better tasting than the regular ice cream. He makes it out of an oat-based, but in America you can't call it ice cream unless it comes from cow's milk. So he was trying to figure out the name for it, and it's called We Can't Say It's Ice Cream. And it has no cholesterol in it, so you don't have to worry about any oxidized cholesterol. And far less sugar as well, but yet it gets very high in the taste test. Second most damaging was pancake mix. Now, they used a popular type of pancakes in America called Aunt Jemima's pancakes, but pancakes are primarily made out of what 3 ingredients? Flour, eggs, and sugar. So you're powdering up the eggs. You know, it comes in this batter that's all powdered up, heavily oxidized. And this is why, Erica, we have a cookbook called Brighten Up Breakfast. As you'll find out, breakfast is the best meal of the day for mental health and for physical health. So we want to have breakfast healthy. And she has 4 pancake recipes in there that are zero cholesterol, so you don't have to worry about oxidized cholesterol. And they're actually tastier than Aunt Jemima's. Third most damaging, Parmesan cheese. This is where you're powdering up cheese, heavily oxidizing it, and it was tied with lard. That's not a misprint. Tied with lard as being the third most damaging. Now, as a result of this, it also explained a couple of other studies. There's 50 states in the United States. Does anyone want to guess which state has the most heart attacks of people in their teens and 20s? In other words, this is the most unhealthy state. They'll see 19-year-olds coming into a hospital with a major heart attack. Their blood vessels already closing off. It's next to Texas, but it's not Texas. It's not California. No, California is quite a bit healthier than this state. It's Louisiana. Louisiana has a lot of the French Cajun food. And they were studying these young heart attack victims. And there was a particular area of Louisiana where this was happening at a higher rate. And so they were looking, they knew that it started in infancy. When you're having a heart attack at age 19, you started to get atherosclerosis when you were an infant. And the way some mothers eat, they're eating at McDonald's, fast food places, the cholesterol in their human breast milk is higher than it is in cow's milk. So they thought that might be the issue. So they looked at infants consuming mother's milk and then infants consuming cow's milk. And they found out which group started the atherosclerosis in infancy. Which group do you think it was? Some saying cow, some saying human breast milk, since it was higher in cholesterol. They found out human breast milk, the vessels were clean. Cow's milk is where they started the atherosclerosis. And they started wondering, why is that the case? Because human breast milk, these mothers were so unhealthy, they were getting this high cholesterol fed to their infants. The difference is human breast milk, how is it consumed? It's directly from the nipple, it's not exposed to the air, and it's not oxidized. And so they were protected. So the best way for you to drink your cow's milk? Go down to the barn and get it straight from the cow. Actually, I wouldn't recommend that. It could produce head trauma. And traumatic brain injury is also not necessarily healthy. Well, vitamin C from fruit and vegetable sources is associated with less depressive symptoms in the general population. Adequate intake of vitamin C has been found to improve attention, work productivity, engagement, and vitality. And this is where we get into the power of whole plant foods. Eating plant foods in their whole form provide great nutritional benefits. Plant foods exceed that of their component parts. For instance, this is a green called kale. Do you have kale here? 1 cup of cooked kale has 50 milligrams of vitamin C and 13 units of vitamin E. It's one of the most nutritious greens you can eat. But the antioxidant potential of 1 cup of kale is equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. This is why we don't feed people A, C, and E vitamins when they come to our program. We're feeding them these whole plant foods because they're going to get far more nutritional value out of that than from a vitamin pill. So the benefits of antioxidants, they reduce the breakdown of neurotransmitters. They've been shown to increase brain serotonin and dopamine concentrations. Isoflavone antioxidants are especially good for the mental health of women in menopause. And antioxidant trials produced improved depression and anxiety scores and quality of life. So the Human Nutrition Laboratory in Baltimore, Maryland took a look at the antioxidant potential of the commonly consumed vegetables in America. Number 10 was eggplant. Do you guys have eggplant here? Loaded with antioxidants. Number 9, corn. Do you have corn here? Okay, good. Number 8, onions. I think you have onions here. Number 7, red bell pepper. Red bell pepper is loaded. It's a very high vegetable in vitamin C as well. Number 6, I had this for lunch today. Beets. Beets are loaded with antioxidants, and they're a great vegetable. In fact, beet powder has been shown to work as well as a high blood pressure medicine and lowering blood pressure, just a tablespoon of that beet powder. Broccoli is number 5. Number 4, I don't know if you would have this here. Do you have Brussels sprouts? Okay, yep, you're saying yes to Brussels sprouts, that's good. Number 3, spinach, loaded with antioxidants. Number 2, you just told me you have that. Number 2 antioxidant of all vegetables is kale. And anyone want to guess what the number 1 antioxidant is? The number 1 antioxidant, I think I heard it. Garlic, loaded with antioxidants. And I'm married to a Romanian, and every entree starts out with 4 cloves of garlic. The top 10 antioxidant fruits. Number 10, grapefruit. Number 9, kiwi. Do you have kiwi? In Zimbabwe. Number 8, cherries. I don't think I saw any cherries here. Are there cherries? Yeah. Number 7, red grapes. Number 6, oranges. Number 5 is a humble fruit. but it's even higher than the other ones. Plums. Number 4, raspberries. Number 3, strawberries. Number 2, blackberries. And number 1, blueberries. Yeah, this morning for breakfast, I had blueberries and strawberries and raspberries all in a fruit salad. And I asked the person serving us, do you guys grow blueberries here? Normally you have to have moist soil, for that. You have to have like a marsh or a swamp type land grows blueberries well. But they assured me that these blueberries were grown in Zimbabwe. Yes, you do grow them. So great to know that. And it's the number 1 antioxidant fruit. In fact, it will help your brain in more than just depression. Studies have shown if you have a bowl of blueberries per week, it reduces your risk of dementia. In other words, you can have a good brain that's healthy as you age. By the way, one of the good brains, he just got back from Madagascar, but I know you have your union president here, but you might want to invite Dr. John Scharfenberg here to Zimbabwe. Dr. John Scharfenberg was born in 1923. He's 101, and he walks on his own power. He still drives a red sports car, and his brain is sharp. He is a physician, but also a nutritionist, and he smiles and laughs. He still has a very good life, and he will tell you how to be able to age gracefully and still have a good brain when you age. But one of his solutions are these antioxidant fruits and vegetables. He's got more solutions than that too. But he just got back, he just traveled by himself to Madagascar, and he talked to 50,000 people in a stadium there in Madagascar on how to live long and live healthfully. So there are 100-year-olds out there, but there's not 100-year-olds like him that are still traveling the world by themselves and still, their mind is sharp and they're still remembering everything from an hour ago or 2 days ago or a long time ago. So I think this concludes our section. There's more that we could say about nutrition. I think I'll add some more tomorrow. There's a lot more we could say about it before we get into the next segment. But I'll open it up for some questions before we close. I know we were supposed to be done at 3, but we started a little late, so that's why I went over past 3. So there's a question here.
Thank you, Doctor. My question is about how we mix the food, fruits and vegetables, and maybe what time is the best. And also maybe about the meals we should take. I'm also studying as a lifestyle counselor, and we know that the best meal of the day is breakfast and, of course, lunch. Then some, they don't take 3 meals, but if those want to take 3 meals, what do you take best? What is the best meal you can take?
So a lot about the timing of things, and you're right about breakfast being the healthiest and best meal of the day. Now, as far as mixing fruits and vegetables, I think it's better that we get the antioxidants than we worry about the mix. But there are some people, just because I'm in the field of gastroenterology, there are some people with weaker lower esophageal sphincters, and if they mix fruits and vegetables at the same meal, they might get more reflux. So because of that, if you're cooking for a large group or people that might have reflux, it might be better to have the fruits at one meal and vegetables at another. So normally in our lifestyle center, we will serve grains, fruits, and nuts dishes for breakfast, and then we'll take the fruits away and do the vegetables for lunch. And that will prevent those that are having sensitivity to reflux. But if you don't have sensitivity to reflux, it's not a problem to be able to mix those together. In regards to, I'll just tell you about Dr. John Scharfenberg, and this is one of the things that we will educate people on. There are advantages of ketosis, in other words, fasting on the brain. And so if you can get by with maintaining your weight and getting enough nutrition with a 2-meal-a-day program, Dr. John Scharfenberg does not eat the evening meal, and he hasn't for a long time. There was a person who wanted to put on a 100th birthday party for him last year, and it was put on in the evening, and Dr. John Scharfenberg showed up for his 100th birthday party, but he did not eat anything. He says, I haven't eaten suppers, and I'm not going to start now. And he talked about how all the rest of his family died in their 80s, and they were pretty healthy, but he said, the difference is I didn't eat my evening meal. And he said the other difference is he got a lot more sun. So from his 50s on, he was out there tending to his fruit trees and gardens, and he was spending a lot of time outside, and we talked about the advantages of sunlight and all of that. So he attributes those two things, in addition to other things that he was doing, like these high antioxidant fruits and vegetables, for his long-term brain health. And you can tell he is not depressed. He'll stand up and he'll be very humorous, and he will laugh a lot, and here he is, 101 years of age, with this big smile. So his own personal experience, of course, adds to it. All right, any other questions? Yes.
Okay, thank you. I have 2 questions. The first one, it has to do with gut health. I'm not sure if maybe you're going to present it tomorrow, or I can go ahead with asking the question.
Go ahead and ask it. I do have a lot of lectures on gut health, being a GI doctor, but I don't have any planned for you tomorrow.
Okay. I'd written down the question. So here in Zimbabwe, we have, there's been a product from South Africa that has been used to improve the amount of bacteria that's found in the soils. And some have also gone on to say that if you take the same product, it has sort of like a mix of different bacteria. It can also help your gut health. So my first question is, to what extent does the gut health of an individual help in terms of their mood? And also, is there need to maintain maybe a certain number of bacteria, healthy, good bacteria in our stomachs?
So yes, a very important question, and this is talking about the microbiome. And the studies are very clear. A healthy microbiome will actually help you to produce more neurotransmitters. There's cytokines released by a healthy microbiome that will actually turn on serotonin production in the brain. This is one of the reasons why even gardening, I didn't talk about it earlier, but working in the soil with our hands with healthy bacteria also help our neurotransmitter production in our brain. And so even working in the dirt, there's a type of bacteria called Mycobacterium vaccae, which is different than the Mycobacterium tuberculosis. Vaccae is healthy, tuberculosis is not. But Mycobacterium vaccae will actually help our serotonin production. So we've actually done studies. There's a microbiome specialist up in Canada that was very interested in our program. And so he studied all of the stools or poop of patients coming to our program, looking at their microbiome, and then he had them repeat their poop 10 days later after they were on our diet. And their microbiome improved significantly. Why? We weren't giving them probiotics. We weren't feeding them bacteria, but we were feeding them prebiotics. Prebiotics is actually these whole plant foods that have fiber associated with it, and the bacteria love fiber because fiber is indigestible carbohydrate that goes all the way down to the gut, and that actually helps a healthy microbiome. So another advantage of more plant-based is you're going to have a significantly healthier microbiome, which can also contribute to the success. So he did it in 2 or 3 programs, and after that we didn't do it anymore. I mean, it's expensive to measure everyone's poop pre and post. But we noticed that it was, it added to the benefit. Now there might be certain cases, they've been on antibiotics or prolonged antibiotics or things like that, that we might actually recommend that they get on a probiotic. There's one called Chiodophilus that we've had some good success with, and there's others as well that can be healthy that way.
Okay. The second question is on there is a form of therapy called animal-assisted therapy. Can it be recommended as a therapy that's maybe in the States? Have you encountered it as something that we can recommend to not just members in the church but also people in the community? Here in Zimbabwe, we have something called working with horses, where we use horses as a form of therapy.
Yeah. So,
By the way,
what's that?
he's a vet.
Okay. All right. Very good. So, a veterinarian. So, yes, we've actually written about it. It's in our Depression the Way Out book as well. Sometimes it's called pet therapy as well, where as we relate to animals and are involved in the care of animals, it does have some benefit for us. And of course, we want the animals to be healthy, and we want to be healthy as well. But I won't go into a lot of details on that, but that is an additional therapy that can be helpful for the brain. We will sometimes do this in our program as well, where we will have certain pets that have an antidepressant effect on individuals as they relate with those pets, etc., that can be healthy. Yes.
I wanted to ask, sometimes we have challenges convincing like clients or patients who are hypertensive or diabetic to stop eating meat or reduce, because they will tell you, no, I'm eating white meat, so I'm fine. White meat is better than red meat. So you can't convince them. As long as they're taking chicken and fish, then they feel they're okay, because they've stopped taking beef. How do you go about convincing somebody?
So yes, one of the reasons why meat is a popular food for diabetics is because it's low in carbs. So it can help you to control your blood sugar shorter term. High in fat, high in protein, no carbs. The issue with it is diabetes is not just about blood sugars. In fact, blood sugars are, we can start chasing our tail when we're just chasing blood sugars, because those diabetics with controlled blood sugars are at a 4 times increased risk of heart attack. They're at a marked increased risk of kidney failure. They're at a marked increased risk of neuropathy, retinopathy. And it's because they're eating high cholesterol foods. They're eating high saturated fat, so they're increasing their cholesterol levels significantly on this diet while controlling their blood sugars. And so the idea is to not just control the blood sugars, whatever it takes for the diet, but to avoid the complications of the disease. And so to avoid the complications, we want a more low-fat, no-sugar, plant-based diet. It will control the blood sugars as well as a meat diet, but it will avoid all those other complications that diabetics run into, including the kidney failure aspect of things. So yeah, that's something that we teach. We have a whole couple of diabetic presentations on that. And why the Diabetic Association is changing as well. They used to, all the diabetic diets used to be low in carbs, and now they're changing that and saying actually the best diabetic diet is a plant-based diet without meat to avoid all the heart attacks, strokes, kidney failure, neuropathy, and retinopathy that diabetics run into. All right, we have a question here, then one in the back, maybe 2 in the back, and then we'll have to close up.
Are the antioxidant fruit and veg good for artery cleansing or for clear arteries?
Yeah, absolutely. So these no cholesterol foods can be part of cleaning the arteries out and be part of a cleansing regimen. Then there was one back there and then one over there.
I have two questions. The first one, when we mix sugar and milk, we create a little alcohol. Is it the same thing when we mix honey and milk? And what's the effect between mixing honey and vegetables? And then the other question is regarding the use of natural fertilizer. Which is better, to use animal manure or the vegetation manure? And what are the reasons behind it? I have heard from your book, the Proof Positive, talking about that, but I didn't actually read that portion myself. So I think if I hear it from the source, it's better.
Okay, so the question regarding the manure for fertilizer. So manure can be a good fertilizer. You want to make sure it's healthy manure as well. What's considered actually better, in America we have what's called organic farming, and there's certain requirements that are necessary to be an organic farmer. You can utilize manure to be an organic farmer. But what's considered superior to organic is called a veganic farmer. A veganic farmer is going to use, basically fruits and vegetable and plant byproducts for the actual soil supplementation. And of course, that has to be nutrient rich as well. And that avoids some of the issues of knowing where your manure is coming from. And some of the things that could possibly get into the plants in regards to the manure. For instance, if you're wanting to look at some of the problems, there's been spinach, for instance, in America with toxigenic E. coli. There have been apples with toxigenic E. coli. And of course, those apples can be in an apple farm where there's cows that are out there, and the apple falls into a cow manure, and it's harvested to make apple cider, and you don't get all of the manure off of it, and it's toxigenic E. coli. You can have a big outbreak of diarrhea and hospitalization and things like that. So that's what we're trying to avoid by doing the veganic farm, but both can be a healthy form. And the first question, remind me again on the first question. Oh, the sugar, yeah, the honey. What about putting honey instead of sugar into milk? It's so similar that it's going to be doing the same things. You're going to be more heavily oxidizing the milk. And you also don't want to be putting milk, because it has sugar in it already, with lactose, with meat. I was in Israel a couple of years ago, and the Jewish people will not mix meat and milk, which is a good thing, because you are going to more heavily oxidize the cholesterol in meat when you're utilizing milk with it. So I wouldn't recommend sugar with milk, and I wouldn't recommend honey with milk. But in regards to honey with vegetables, that would be healthier, because you don't have to worry about oxidizing any cholesterol when you put it that way. So if you're not a diabetic and you can take a little bit of honey, putting it with more of your plant-based foods is not going to be that dangerous. And then a question here.
Thank you, Doctor. I am failing to structure my question, but I hope you hear me out. So in terms of all you're presenting, Zimbabwe presents a challenge where the policymakers, is, for example, our government hospitals, they're struggling to maybe perhaps give people the right nutrition. I talked to Dr. Mangezi at some point. He's the chairman of the National Mental Health Board. So on a mental health advocacy type of thing as I do, how can we, or how is the model in America in terms of policy making towards such things as encouraging healthy diets towards, because the majority of Zimbabweans, all those things you have written 1 to 10, I think it's a few people who can afford to buy strawberries. So it's a challenge. How can we help, or how can I assist to give the ideas to the policymakers of our country? Thank you.
Yes, well, I would certainly give them ideas based on the research and not necessarily consensus organizations. Consensus organizations often look at political factors, they look at a lot of other factors, they don't want to upset the apple carts of their support groups, et cetera, and so they're not as scientifically based. In fact, often against science base. So you do want to base it on actual true science, but in regards to America, there's an organization that you might have heard of here called the American College of Lifestyle Medicine. I was actually one of the founders of that medical specialty. It's now a medical specialty. And in every hospital, hopefully they have a lifestyle medicine physician that can do a consult. If the patient is there because of lifestyle diseases, they ought to see a lifestyle doctor that can tell them what to do so they don't have to get readmitted to the hospital. And the ACLM is very consensusly agreed upon in regards to the advantages of a plant-based diet for not only mental health, but physical health, cancer, heart disease, autoimmune disease, a lot of those sorts of things. So doctors are now able to much more readily order a plant-based diet for their patient and still get a healthy, tasty regimen at the hospital. The hospital I serve at is a secular, large hospital organization in Northern California called Sutter, but some of the doctors there in lifestyle medicine help to campaign the cafeteria to be able to get nutritious plant-based meals that were tasty. And so we can offer that to the patient and say, you know what, I think your heart disease would get a lot better if you did this. Are you interested in doing this? And they'll often say, yeah, have me give it a try. And the hospital will supply that now. So I would use ACLM. That's the abbreviation if you want to look at consensus organizations that could help your hospital cafeterias and the dietary recommendations for those that are having significant disease processes. Well, you've been a very attentive group. Enjoyed being with you today. We have one more day tomorrow, and pray for me that I prioritize things right so I can give you what you need the most in regards to this. There's a whole lot of topics we could talk about and a whole lot of things, obviously, in the mental health arena. You know, there's 60 different presentations I could give you. I can only give you about 3 or 4 tomorrow out of that, and so hopefully I'll choose what's best for you here in Zimbabwe. But I'll turn it over to our conference leaders here.
Thank you very much, Doc. What do we say? I think we have gained a lot. So my plea is that I think bring someone tomorrow, okay? If you are really concerned about your